Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk every Tuesday about all kinds of global health issues. I am Joe Schmitt, and I am here with Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt. Hello, everyone. Good morning, good afternoon, good evening, wherever you are watching this Global Healthcast from.
And here are the topics we want to talk about today. We give you a COVID-19 update. We will ask the question if epidemics increase with the use of internet. We will look into the modeling effects of masks, and we will start to predict outbreaks for 2022 and beyond. We will talk about measles and other infectious diseases that we worry about today that may come next years. So Melvin, what is the update on COVID?
Yes, so again, this is from the WHO COVID-19 situation report released a few days ago, and this is from the same report that I show almost every time we have this Global Healthcast. The number of weekly cases increased for the fifth consecutive week after a declining trend since March this year. Now over 5.7 million new cases were reported, and this is a 6% increase compared to the previous week. And the number of new weekly deaths was similar to that of the previous week, with over 9,800 fatalities. Well, in summary, much more cases were recorded last week, but fatalities stay the same. And
Melvin, I looked at this earlier today, and what I saw is maybe something we can highlight. The number of cases, let's say here in April, and you see the number of cases is the same here and here in 4th of July, and the number of deaths was much higher.
yes.
What does that tell you?
So it tells us that we are doing something right. And I would presume that this is the vaccination that's working, because the vaccination for COVID started in late 2020, right? In December and January, early 2021. And that really shows, because if you look at the number of cases down, the colored ones, in the first few peaks, you will see that the deaths and the cases sort of coincide, right? You see a lot of cases, then you see a lot of deaths. But then, if you look at December 2021, you see that the cases are even much more than what we had in the previous waves, but the deaths are decreasing, and so it really is clearly showing us that vaccines are working.
Very good news. And I think you have some more here. What is it in Portugal?
Yes, I want to focus on Portugal because Portugal is one of the most fully vaccinated countries in the world. Over 90% of the people in Portugal are fully vaccinated. And every time there's a new variant, whether it's Delta, Omicron, or Omicron subvariants, people always point out to Portugal, right? They always say that vaccines do not work because there is a surge in cases in Portugal. And they always say that, look at Portugal. They have over 90% vaccinated and still they are suffering from COVID. So you will see here, this is showing us confirmed cases of COVID-19. You will see that from November 2020 to February 2021, there was a surge in cases. And from June 2022, because of the Omicron subvariants, right? And cases are even more than the surge in November to February 2021. But if you look at the next slide on deaths, you will see a corresponding increase in deaths during the November 2020 to February 2021, with over 200 deaths a day. But for the recent surge since June, deaths have never reached over 60. The November 2020 to February 2021 surge included the time when there were no vaccines, and it was a time when vaccination started. So for Portugal, like in most countries with high vaccination coverage, you will see that clearly vaccines prevent serious illness and prevent deaths from COVID-19.
Yeah, interesting. So it's another nice detailed set of data to show the effectiveness of vaccines and the impact of vaccines. Very reassuring. Yeah.
Yes, definitely.
I have more on outbreaks. This is from a WHO website, and you see on the left side here always the date of the report, and then it was Ebola virus, severe acute hepatitis of unknown etiology in children, wild polio virus type 1, cholera in Pakistan, Crim-Congo hemorrhagic fever, dengue, monkeypox, and we talked about that in our Global Healthcast special lately. Influenza in Germany, Middle East respiratory syndrome, another coronavirus in Oman, cholera in Cameroon, monkeypox in the United Kingdom, Lassa fever. This is all increasing, and the question arises, is it really increasing, or is it the internet? Is it really the internet that causes infectious diseases, so to speak, and outbreaks? So this is a nice study, and what they looked into is from 1984 compared to 2005. What increase is the number of outbreaks, but also the type of infectious diseases agents that cause outbreaks. So what you can see clearly by the increasing dark red colors here on the right lower map, 2005 to 2009, that indicates that the number, but also the number of different organisms causing epidemics increased over time. The main findings from the study are that the total number and the richness of diseases, that's what they call the diversity of organisms causing an outbreak, increase over time, whether controlled for interusage or not. So the internet is not the cause of the outbreaks, apparently, right? Then the internet can improve disease reporting by supplementing formal surveillance with publicly generated digital disease surveillance. You get more information and you get it more rapidly. Very simple. And then internet usage and other national communication infrastructures are important to incorporate into analyses exploring changes in infectious diseases over space and or time. So we need this. This is really very, very helpful to get early on information. There is something going on, look into this. But my main pledge today is this is good, but it's not enough. We need detailed scientific valid incidence data. We need burden of disease data. If there is an outbreak, so to speak, with 10 subjects who visited a birthday party and had the same dinner, or if there is a national outbreak, this is what I'm interested in. And we really need burden of disease data, and governments are a little bit lazy or not interested, I'm not sure, to really look into infectious diseases. TBE is one example. Many countries in the world don't even have a test for a TBE virus. I mean, in Europe and Asia, even epidemic countries, endemic countries like Japan, you cannot buy an ELISA test there. So you don't see the disease, very simple. So I think much more needs to be done. Melvin, any comments on this or shall we go on?
No, just one thing. I guess most people are just interested in infectious diseases when there are outbreaks, but the government should be consistent. They should do that even when there are outbreaks or not, right? Because
Yeah.
without these kinds of data, we will not know if we just have these outbreaks because we're looking for them, or are they really happening without us looking for them? So those are two different things, I think.
Yeah, I agree. Governments should systematically look for infectious diseases and not just if there is a problem or if there appears to be a problem, because TBE is present all the time, but people don't test for it and then you don't see it. It saves you money, I guess. I'm not sure. Maybe it does not save you any money. Anyway, you have something on modeling effects of masks.
Yeah, so we have known for a while now that masks work, right? Masks are very useful in this pandemic. But for me, this study is important because it is a physics-based modeling of masks, looking at the accumulated viruses that a healthy person inhales as a function of time. Um, Also looking at activity level, type of mask, and room condition. So they consider different types of masks, such as surgical masks and filtering face pieces or the FFPs, and also different characteristics of public places, such as office rooms, buses, trains, and airplanes. And the results confirm the importance of both people wearing a mask compared to when only one wears the mask. The results also show that the protection time before the healthy wearer has an infection risk is reduced by 50% if only one wears the face mask instead of both people wearing a face mask. It also shows that the protection time is further reduced if the infected person starts to cough or increases activity. So it's really helpful because I think we have known for a while now that masks are working, but with this physics-based modeling study, it gives more scientific proof and more robustness to what we have known for a while now. And it also tells us that leakage of the mask, whatever mask you're using, can considerably affect the performance of your mask. So it's important that the mask is well fitting. And it also showed that for surgical masks, for example, the filtration efficiency is reduced with leakage, and this is a problem, right? Because many people are still wearing masks in places where masks are mandated. But then if you're not wearing masks properly, if there are openings on this side of your face or on the other side or on the nasal area, basically if there are leakages or if your mask is not fitted well, then it's not really as protective as you think it is.
I'm wearing a surgical mask whenever I approach a crowd. I guess that now justifies what I'm doing, right? The surgical mask, when I walk through the pedestrian area, downtown Mainz, that's when I may want to ask the surgical mask. But other than that, I use this FFP2. Or here, this is the one. I still worry. I'm 60 plus, right? I got my fourth dose already, but I worry I don't want to get sick. And just to remember that COVID is a systemic disease. It's not only the lungs. It will be in your brain, in your heart, in your whatever type of other organ, even the kidneys. So I worry about it still, and I'm wearing surgical masks. Yeah. Very nice, Melvin. This is really great, great publication. Thank you. I have a little bit more, and Melvin may help me here, predicting emerging infectious diseases and outbreaks beyond 2022. And COVID, that will stay with us for how long, Melvin? What do you think? How long will we have it around?
Well, we will have new variants for sure, right? Omicron will not be the last variant. And we have all these subvariants now, BA.1 up to BA.5, and now we're hearing another new variant in India. So I think we will be hearing about COVID for years to come.
I would predict it is like influenza. We will have annual winter outbreaks on the Northern Hemisphere. I'm courageous. I'm 60 plus, so nobody will charge me with wrong statements in 20 years, right? But I would say this will become a new influenza type disease, but I may be wrong. Would you have any thoughts or hypotheses or theories?
No, I think it will sort of become like an influenza that comes during the influenza season.
Yeah.
Yeah.
And interfere, yeah. Monkeypox, we had this special about a week ago, and you can still see it. It's still for download. Melvin, will it stay with us or not?
It's already in 60 countries. These are the countries which were not considered endemic in the past. So now I think the total number of confirmed cases is around 10,500 all over the world. And so for me, it's already out there, right? And I think it will be with us for years to come. And people are not vaccinated. Even though we know that in the past, smallpox is offering cross protection, not most of the people now existing in the world are not vaccinated with smallpox, and yeah, it's transmitted via droplets and also with close contact with people. So as long as people are in contact with other people, this will spread. So I don't think we will be able to stop this from spreading.
I think it will become a major public health concern in the future. And the reason is, it is, I guess you could call it a sexually transmitted disease. And as you cannot avoid sex when you get to a certain age, it will be with us for the rest of our lives. Again, I just make the statement. I'm not sure if I'm wrong, but this is my concern.
Yeah, but also I think we have to highlight that at the moment, many of the cases for monkeypox are sexually related, right? But you
Yeah,
don't have to have sex to
yeah,
have
yeah,
monkeypox.
yeah. Diseases will increase by tick-borne encephalitis. We will have a very high number of cases again in Germany this year, likely because many people don't travel to southern countries like Spain or Italy. They stay home and they are not protected by vaccination. And so numbers will increase. Also, we will see an increase in dengue, chikungunya, Ebola, Lassa, and Marburg virus diseases. And I don't want to cover this in all detail. There will be outbreaks of these. This is predictable, right? It will not be like monkeypox or COVID. They will not stay with us all the time, but there will be outbreaks every once in a while, I guess. Any comments on that?
Well, for dengue, I know for one that Vietnam has announced just recently that the number of dengue cases have doubled compared to the same period last year. Same thing in the Philippines. The number of cases have increased by over 90% if you compare it to the number of cases last year. Um, Looking at, for example, chikungunya uh, in India, there always is a chikungunya outbreak, and this time it's in the region called Pune. Marburg virus, I remember that I read something about Marburg virus just recently. There is an outbreak in Ghana, a country that has not reported an outbreak of Marburg in the past. So yeah, it's not a good sign.
Yeah. So these viruses will stay with us. We will have outbreaks. RSV, and here we haven't had much of a large RSV season in infants lately because of lack of exposure. We had a lockdown, we were wearing masks, so children did not go to kindergarten and schools, so RSV did not circulate. And what will happen this winter, Melvin? What do you think?
Well, since we are not in lockdowns anymore, we expect to have some an RSV season as well, like the flu season. But I guess like what is written here on the slide, right? There's no vaccine for RSV at the moment, but there is a medicine that can help protect babies at high risk for severe RSV. And this medicine called palivizumab is given to premature infants and young children with certain heart and lung conditions as a series of monthly shots during the RSV season.
Yeah, and there are a large number of vaccines to come soon, monoclonal antibodies, but also active maternal immunization to protect for the first winter season. And that will come very, very soon. We are in the late stages of the phase 3 study. So stay tuned on RSV and we will inform you what's going on there. Finally, polio. There was a vaccine-derived poliovirus found in the London sewage. So if vaccination rates go down, we may at some point see polio cases again. I worry a lot about diphtheria. We had this outbreak in Russian-speaking countries in the 1990s when vaccination rates went down in these countries, and all of a sudden diphtheria was a big concern and there were thousands of cases. But I also worry about pertussis influenza, meningococcal meningitis, and my main concern is measles, and here is why. Measles virus needs an uptake of 92 to 95% with 2 doses to get herd protection. Rubella virus, it's only 85 or 87%, and polio virus only 80 to 85%. So you have good protection of your population if you are above these numbers. And here is real life data from Germany. And what you see here, yellow, measles, 1 dose, dotted blue line, measles, 2 doses, and these are for the rubella virus. Let's concentrate on measles. You see 1 measles dose, according to this data, is here well above 95%, so we should not see an outbreak. And this is so since, let's say, 2007. And measles 2 doses, they passed the 90% line around 2008. And according to this data, it is now above 90%. The problem with this data is it is not representative. It doesn't show us on-time vaccination. So if the second dose only comes at age 10 years, then you are not fully protected until you're 10 years old. So there is a large part of the population that is only partially protected. So you still need a higher uptake, right? So the uptake number, 92%, is really not valid. This is partially based on school entry data. This is 3 to 4 years late. We need them at age 2 years. Have you had your 2 doses? In addition, we know there are local unvaccinated pockets. So some regions in Germany don't approach this 90%. They may be even well below 50%. And then you can expect there will be outbreaks. And again, the main concern is the whole data set here is not population-based. So this indicates you are protected, but you're not. And again, let's look at 2008 here. That should be the time when we should not see any outbreaks. This is the real number, but we do see outbreaks in 2013, 2015. Then outbreaks went down because natural diseases gave you immunity. Then we had the COVID lockdown. There was no opportunity for the measles virus to expand because everybody was wearing masks. Their schools were closed for some time and so on and so forth. And also, and I told you about that in a previous Global Healthcast, there is a vaccination gap now due to COVID. Vaccines were not given because of children did not see their pediatrician. So I expect there will be measles outbreaks, and I'm not the only one who is concerned about that, but also UNICEF and WHO. They said this is a perfect storm of conditions for measles outbreaks affecting children, and the details are here. I don't embark on that. Any comments, Melvin?
Yeah, and this has been highlighted as well in the early part of the pandemic, right? That one of the issues will be because people are in lockdowns, they're not visiting their pediatricians or the healthcare centers, kids will not be vaccinated. And it's expected that there will be gaps of vaccine preventable diseases, not just measles. It's including BCG as well for other countries that are giving BCG. It's including diphtheria, tetanus, pertussis, and all the other vaccine preventable diseases. So yeah, it's indeed a perfect storm that's going to happen in the next couple of years.
And that ends our outbreak session for today. And here is what we talked about today. Melvin showed you that the COVID number of cases increases, the deaths stay the same, and that is due to the effectiveness of vaccination, of additional doses, as he exemplified with the global data, but particularly from the data from Portugal. Do outbreaks increase in number, and is the internet the cause of outbreaks? And yes or no, right? There are different reasons why we may see more infectious diseases outbreaks: climate change, more exposures due to flying and visiting others, more contacts with others. And the internet is very helpful in identifying them. But as I told you, I think we need government-based systematic disease surveillance for all infectious diseases. Melvin showed you that masks do protect if you use them. And then in our last part, we predicted outbreaks for 22 and beyond, measles and more. If you have any wishes, which topics we should cover in the future, please write us to ghc@globalhealthpress.org. We're happy to look into what you are interested in, and we will cover that in one of our later sessions. You can download the PDFs of our show notes in the link below our cast here, and please like, share, or leave your comments as well if you wish. Thanks for listening, and I am Joe Schmitt, and with me is Melvin Sanicas, who will explain you what the Louvre is doing.
Actually, when I first saw this photo, I was thinking, why is Mona Lisa getting a vaccination? I guess this is a booster, right? Mona Lisa is basically over 500 years old, so she's an elderly. And we know that the second boost helps with protection against COVID, serious disease and hospitalization and death. So I think because now the Louvre is opening for tourists, right? she needs her second booster.
Very good. So you can safely visit the Louvre again. Thank you again, Melvin.
Thank you. Thank you very much, everyone.